Welcome to the Ultimate Depression Survival Kit, How to Overcome and Master Depression with me, Dr. Moses Simoyemba. We are on day 12 and today we look at how to get the most from professional help. There are various reasons why you might consider or need professional help when it comes to depression. One reason is that you might not be ready to disclose to family and friends. Sometimes it is very hard to talk to people close to you about what is happening to you and what you are going through. And so during such times, it might be helpful to find somebody neutral, somebody you don't know, to talk to, and you might be more free to talk to them, especially if you feel your family or friends may not be supportive. Another reason is that even though you might be able to talk to family and friends about it, they just may not be in a position to help. They may not know enough about depression to know how to help you, and so then you need to see a professional. Another reason is medication needs, because antidepressants are prescription drugs and therefore you need to see a licensed professional in order to obtain them. I do cover antidepressants in the second part of the video for today. I've split it into two just because both are rather bulky, and so to keep them short and manageable, we talk about antidepressants in a separate video for day 12. Seeking help from a professional can also help you to understand the roots of your depression more deeply, and we will cover in this video why that is. So seeking help professionally can help you to talk to someone neutral. It can help you to make faster progress because these are experienced people who have helped other people in your situation and therefore know well what works and what doesn't work in particular situations. But it may also be necessary to seek professional help if you are experiencing self-harming behavior or thoughts or suicidal behavior or suicidal actions. Therefore, at such points, it is absolutely necessary to see a professional, and we've already covered medication needs. So what kind of professional help is there out there? What kind of professional help is available? Well, there are various mental health specialists, including psychiatrists, clinical psychologists, social workers, and licensed mental health counselors. Now, it is important to consider your setting, because not all these names will be relevant depending on your setting, and some of these professions are called different things in different settings. Some may be called different things here, but they mean one and the same thing in your setting. So you just need to be aware of your particular setting and what nomenclature is, but generally these are the types of professionals that there are to handle mental health issues and depression. There are other forms of professional help available, including the faith community, that is church or religious kind of settings. This is the faith community I refer to here. It can be very useful to talk to in terms of understanding things, and sometimes there's a spiritual dimension to what we may be experiencing, and the spiritual dimension can help us to deal with what we are going through. There are also various support groups available. These are made up of people who are also going through similar issues that you have or have gone through them in the past, and therefore they form support groups to help other people experiencing depression. Group counseling and peer support is also available, so sometimes you may go through group counseling. We'll cover that in a short while, rather than individual counseling. Other than that, there are in a lot of countries, most countries, helplines of various sorts to help people with various mental health conditions and depression in particular. And these helplines also, in some cases, are crisis helplines in terms of dealing with suicide and such circumstances. So these are the range of help available, quite a broad spectrum, and we'll cover some of these in a little more detail in the slides to follow. There are various forms of talk therapy that are beneficial when you're going through depression in order to help you understand what's happening to you and overcome the depression. So let me say from the onset, we covered this in the video about myths, where people think that talking about depression only makes it worse when you're going through it, that if you talk about it, it will not help you, it will just make things worse. And we covered in that video that this is a myth, because actually it has been found that talking about it actually helps you to understand it better and to recover. And in this video, we'll go through various evidence or research around that shows that talking, various forms of talk therapy are helpful. So one form of talk therapy that is helpful is counseling. So a counselor basically helps you think about the problems you're experiencing in your life so you can find new ways of dealing with them. Generally, counselors support you in finding solutions to the problems, but they do not tell you what to do themselves. The idea of counseling really is to have a listening ear, somebody that can listen to you, somebody that can ask you the right questions so that they lead you down the correct path of thinking in order for you to come up with the solutions for yourself. So the aim is not for them to provide the solutions, because they don't know everything about your life. It is impossible in the time you spend with a counselor for them to know everything about you. But if they guide you correctly, you will be able to find solutions to the problems you are facing, or if not that, to understand them better and at least cope better with them. Generally, counseling consists of 6 to 12 sessions that last about an hour. Again, this depends on your setting and the particular counseling you've sought, but these are just examples of what normally happens. Thus, with counseling, you talk in confidence to a counselor who supports you and offers practical advice. But at the end of the day, it is up to you to think of solutions. Counseling is ideal for people who are generally healthy but need help coping with a current crisis such as anger, relationship issues, bereavement, redundancy, infertility, or a serious illness. So that is the usefulness of counseling. It can also be helpful to go through counseling even when you are on antidepressants, depending on your setting and depending on what other professional help is available. In a lot of settings, this may be the only form of talk therapy available for most people that is accessible and affordable, and therefore it is a good option. Let's look now at psychotherapy, which is a little different from counseling generally. It is one form of talk therapy. It involves discussing your problems and how you feel with a therapist. Usually, psychotherapy is combined with antidepressants or some other treatment to make it more effective or to get the benefits of both treatments. The idea of psychotherapy really is to track your moods and practice new ways to react to people and things that happen to you. Usually, during psychotherapy sessions, you'll be given homework, including tracking your moods and journaling. We'll talk about journaling in another video. So this is about psychotherapy. It can help you to detect patterns of thought or behavior that may contribute to your depression. It can teach you exercises to reduce stress and anxiety, and can create strategies to identify and avoid any triggers that exacerbate your depression. Additionally, psychotherapy can be helpful in developing coping mechanisms and understanding your illness better. So you can see that it goes more in depth than just counseling. It is about talking in more detail about how you feel, what has happened to you, how you react to certain situations. It is also about strategies to learn how to reduce stress and so on. So definitely more detailed than just purely counseling. There are various forms of psychotherapy as well. There's individual therapy, which involves just you and a therapist. There is also psychotherapy that involves groups or working in groups. This is group therapy with 2 or more other patients. It can be helpful to see that others have problems like yours and to get to understand depression from multiple angles. And you may find when one person is discussing something, it also clicks to you that, oh, this applies to you too. So group therapy can be very helpful. Couples therapy also is available. It helps your spouse or partner understand your depression, and they can learn how their words or actions can help you as you try or journey to overcome depression. Family therapy is also available, and it helps loved ones learn how depression affects you and how they can better support you as well. So you can choose what kinds of therapy you want. Generally, Most people will start with individual therapy, and depending on what comes up during that individual therapy, they might actually find that they then need to involve other people, such as their spouse or partner or other family members. Cognitive behavioral therapy, or CBT as it is commonly called, is another form of talk therapy. CBT recognizes that the way we think, or cognition in other words, and act, which is our behavior, affects the way we feel. Therefore, that is why it's cognitive behavioral therapy, because it looks at your thinking as well as your behavior and how that affects how you feel. It is one of the most effective treatments for depression, as has been shown by quite a bit of research, and is useful for a wide range of ages, including children, adolescents, adults, and other people. It basically aims to help you understand your thoughts and behavior and how they affect you. CBT helps you to think rationally about common difficulties, helping you to shift negative or unhelpful thought patterns and reactions to a more realistic, positive, and problem-solving approach. So again, problem-solving skills and coping skills are very important in CBT. It recognizes that events in your past may have shaped you, but it focuses mostly on how you can change the way you think, feel, and behave in the present. So it is very much focused on current situations, or current solutions rather, whilst at the same time recognizing that you need to deal with things that may have happened to you in the past, but in your current situation and current present time. CBT teaches you how to overcome negative thoughts. For example, feelings of hopelessness and helplessness, which are very common in depression. Usually you have 6 to 8 sessions over 10 to 12 weeks on a one-to-one basis with a counselor trained in CBT. This varies according to setting, but this is ideally the setup you will encounter. Group CBT is also possible, as we have seen with psychotherapy generally, that you can have group sessions. Group CBT is also possible. So here is one study by Necht et al. Done in 2016 titled "The Treatment of Chronic Depression with Cognitive Behavioral Analysis System of Psychotherapy, a Systematic Review and Meta-Analysis of Clinical Trials." This study found that the combined overall effects of cognitive behavioral therapy, let's just simplify it to that, versus other treatment or treatment as usual, pointed to a significant effect of small magnitude. In particular, cognitive behavioral therapy revealed moderate to high effect sizes when compared to treatment as usual and interpersonal therapy, and showed similar effects when compared to antidepressants medication, so just as effective as antidepressant medication. But the conclusion was that the combination of cognitive behavioral therapy and antidepressant medication yielded benefits over antidepressant monotherapy. So better to combine it with antidepressants, then that becomes more effective than just antidepressants alone. So quite good evidence for that here. Mindfulness-based cognitive therapy is another variation, another form of psychotherapy. It is generally delivered in groups and involves a type of meditation, I beg your pardon, called mindfulness meditation. In another video, we do cover in more detail mindfulness and the research around that, but here we focus on mindfulness-based cognitive therapy. It teaches you to focus on the present moment, so being mindful and just noticing whatever you're experiencing, whether it's pleasant or unpleasant, without trying to change it. So normally it starts with physical sensations like breathing, but then moves on to how to be mindful about your thoughts and your feelings, so that over time you become more aware of both the physical, but as well as your thoughts and emotions. It can help you to stop your mind wandering off into thoughts about the future or the past, and avoid unpleasant thoughts and feelings, because we know that often when one is depressed, you get stuck either in the past, thinking about what happened, or you get stuck in the future, worrying about the future. So it helps you to focus more on the present. It enables recognition of negative patterns and feelings early on as a way to avoid relapse of depression. In this way, you're able to deal with warning signs earlier and more effectively. So you become more aware of how you feel, what you're thinking, and therefore you can be able to recognize early warning signs of depression. And I have found this to be very true in my own experience, that when I'm more in touch with my feelings and my thoughts, I'm able to recognize those warning signs and therefore able to take quick action early on before things become serious. Let me share just a few quick studies on mindfulness-based cognitive therapy. Here's one by Goldberg et al. In 2018. It was a systematic review of a whopping 142 different samples or studies titled Mindfulness-Based Interventions for Psychiatric Disorders. So in this study, at post-treatment, that is after the treatment, that mindfulness-based interventions were superior to no treatment, minimal treatment, non-specific active controls, and specific active controls. Mindfulness conditions did not differ from evidence-based treatment. In other words, the conditions were just as good as other evidence-based treatments such as antidepressants. At follow-up, mindfulness-based interventions were superior to no treatment conditions, non-specific active controls, and specific active controls. Further, mindfulness conditions did not differ from minimal treatment conditions and evidence-based treatments. Effects on specific disorder subgroups showed that most consistent evidence in support of mindfulness for depression, pain conditions, smoking, and addictive behaviors. Results support the notion that mindfulness-based interventions hold promise as evidence-based treatment. So very good evidence from 142 studies there. Here is another paper by Sinatra and Black, published in 2018, and they reviewed 10 studies. It is titled Mindfulness-Based Interventions for Cancer Survivors. What do we know about the assessment of quality of life outcomes? And this study found that compared to usual care, significant post-intervention effects of mindfulness-based interventions were found for health-related quality of life, fatigue, sleep, stress, anxiety, and depression. So it helped with all those things. Up to 6 months after baseline, effects were significant for anxiety and depression. So the effects lasted for a long time, and significant for anxiety for up to 12 months. So even up to 12 months, effects on anxiety were still significant. Compared to other active interventions, significant effects were only found post-intervention and only for anxiety and depression. So you can see that mindfulness-based interventions in cancer patients showed lasting effects and was very effective in helping with anxiety and depression. And another one by Van der Velden, 2015, a systematic review of 23 studies, and it's titled A Systematic Review of Mechanisms of Change in Mindfulness-Based Cognitive Therapy in the Treatment of Recurrent Major Depressive Disorder. 12 studies found that alterations in mindfulness, rumination, worry, compassion, or meta-awareness were associated with predicted or mediated mindfulness-based cognitive therapy's effect on treatment outcome. So these are the things that affected rumination, worry, compassion, and meta-awareness. In addition, preliminary studies indicated that alterations in attention, memory, specificity, self-discrepancy, emotional reactivity, and momentary positive and negative affect may play a role in how MBCT, mindfulness-based cognitive therapy, exerts its clinical effects. So all those effects it had on memory, specificity, attention, emotional reactivity, and so on. The results suggest that MBCT could work through some of the MBTC model's theoretically predicted mechanisms. So there are even mechanisms postulated as to how this could work. So read the paper if you want to go more in detail on that. So generally, mindfulness-based cognitive therapy has strong evidence to show its effectiveness, even as strong as antidepressants. Interpersonal therapy is another form of talk therapy for you to consider. So interpersonal therapy focuses on problems in personal relationships. So that's the distinction from the other forms of talk therapy, and the skills needed to deal with these problems in your personal relationships. It is based on the idea that relationship problems can have a significant effect on someone experiencing depression and can even contribute to the cause. And this is very common, for instance, in intimate relationships such as marriage, where interpersonal therapy may be of great value. It helps you recognize patterns in your relationships that make you more vulnerable to depression, and it focuses on improving relationships, coping with grief, and finding new ways to get along with others. So that is hence the name interpersonal therapy. There is some evidence that interpersonal therapy, or IPT, can be as effective as antidepressants or cognitive-based therapy, cognitive-based behavioral therapy, I beg your pardon, but more research is needed. So interpersonal therapy to do with your relationships and how to handle problems within that. Psychodynamic therapy is another form of talk therapy. In this kind of therapy, a psychoanalytic therapist will encourage you to say whatever is going through your mind. So it's one of those things that let your thoughts go and just say whatever comes in your mind. And this will help you become more aware of hidden meanings or patterns in what you do or say that may be contributing to your depression or your problems. And the psychoanalytic therapist will help you to identify those patterns. You may look at problems that may have started in childhood through these sessions as well. So it's one method that's used when it comes to dealing with childhood trauma, such as neglect, sexual or physical abuse that we've discussed in another video. Let's look at some quick research on psychodynamic therapy. Steinert et al. In 2017 did a systematic review of 23 clinical trials, and the paper is titled Psychodynamic Therapy as Efficacious as Other Empirically Supported Treatments, a meta-analysis testing equivalence of outcomes. So they were basically trying to test whether psychodynamic therapy is as effective as other forms of treatment for depression, such as antidepressants. Statistical analysis showed equivalence of psychodynamic therapy to comparison conditions for large symptoms at post-treatment and at follow-up. Results suggest equivalence of psychodynamic therapy to treatments established in efficacy. Further research should examine who benefits most from which treatment. So finding that psychodynamic therapy could just be as effective as other established treatments for depression, such as antidepressants. Okay, so let's talk very briefly about depression support groups, which is one of the help you can get. So depression support groups are geared towards meeting the needs of those with depression. It is not strictly psychotherapy, but it can provide you with a safe and accepting place to vent your frustrations and fears and receive comfort and encouragement from others who have gone through similar things that you have, or maybe going through it as well. Share coping suggestions that others find useful, so you can also get suggestions from others on what they have tried, what they have done to help them cope or overcome depression. It is always assuring, of course, to know that someone else knows what you are going through. So that is one benefit of group sessions or depression support groups. The best experts on depression are those who have gone through it, as I always say, and therefore you will benefit immensely from hearing from other people who have gone through depression as well. But however, always check with your doctor before taking a new suggested remedy, or if you found something in this video series on the Ultimate Depression Survival Kit, you can also learn from other people how they've utilized it and therefore know that there is evidence for its effectiveness. But nevertheless, if you are seeing a professional like a doctor, a psychiatrist, always good to run it by them before you take anything that others may recommend. Lastly, when it comes to professional help, before we go into the next video on antidepressants, let's look at electroconvulsive therapy. This is one that perhaps has been exaggerated in movies and makes you think of Frankenstein-like scenarios, but it is actually not that scary a process. Electroconvulsive therapy has been shown to be of benefit in treating depression symptoms. It is a brain-stimulating technique, basically. Electrodes are placed on the patient's scalp and a finely controlled electric current is applied while the patient is under general anesthesia, so you are asleep during the process. The current causes a brief seizure in the brain, and ECT or electroconvulsive therapy is one of the fastest ways to relieve symptoms in severely depressed or suicidal patients. So it's very effective in severely depressed and suicidal patients. Let me share 4 studies very quickly on electroconvulsive therapy. The first one is by Elias et al. Published in 2015. It is a review of 5 studies titled Electroconvulsive Therapy in the Continuation and Maintenance Treatment of Depression. So according to this study, continuation electroconvulsive therapy and maintenance electroconvulsive therapy, both with pharmacotherapy, that is antidepressants, were associated with significantly fewer relapses and recurrences than just antidepressants alone at 6 months and 1 year after a successful acute course of ECT. Modest efficacy of continuation electroconvulsive therapy and maintenance electroconvulsive therapy with concomitant pharmacotherapy in preventing relapse and recurrence of depressive episodes for 1 year after the remission of index episode with the acute course of ECT. So basically that's showing that ECT was effective alone as well as in combination with antidepressants, and the effects were there even 6 months and a year after that ECT session or those ECT sessions. So good evidence there. The next study by Gracia et al. Done in 2015 looked at 8 case reports and 8 studies, and it was titled Postpartum Electroconvulsive Therapy. So it looked at electroconvulsive therapy in women undergoing or going through postpartum depression. This study found that ECT is effective in the postpartum period. It is well tolerated, provides a fast response, and allows for breastfeeding. In addition, our case report showed the benefits of the hospitalization of the mother-baby unit. So, in fact, the mother-baby were together during this time also helped. Combined ECT and joint mother-baby hospitalization could be a valuable treatment by targeting both the mother-infant relationship and the maternal depressive symptoms. So it not only helped the mother bond better with the baby, which is a problem with postpartum depression, as you know, but also helped to reduce symptoms of depression in the mother. A quick study by Youssef and McCall, 2014, relapse prevention after index ECT in treatment-resistant depression. So this study concluded that most studies suggest that combined ECT and continuation pharmacotherapy are the most effective strategies in relapse prevention. They found that ECT and continuation pharmacotherapy may be more effective than either alone for preventing relapse. So ECT shown there to be important in preventing relapse of depression. The last study we'll look at involves safety of ECT, and Bill and Vidbeck in 2018 did a systematic review of 32 studies to look at safety of ECT, titled Electroconvulsive Therapy Increases Brain Volume in Major Depression. And they found that MRI studies did not find any evidence of ECT-related brain damage. So that is a relief there, and showing that there's no damage due to this shocking of the brain during electroconvulsive therapy. The MRI studies do not support the hypothesis that ECT causes brain damage. On the contrary, the treatment induces volume increases in frontal limbic areas. So the frontal cortex, the frontal limbic areas are the areas that are important in emotion and such things, and therefore it causes an increase in this area, and this is thought to be of benefit in terms of overcoming depression. All right, so this study was very important in showing that there is safety when it comes to ECT. So there you have it, psychotherapy, counseling, group counseling, electroconvulsive therapy are all choices when it comes to seeking professional help. As mentioned, we will cover antidepressants in the next video. The bottom line is there is a lot of help available to you in terms of getting help for depression. And at some point, I recommend you do get some form of professional help. It is always good, as much as you're trying other strategies on your own, to also get professional input. It will help you to recover more quickly and gain insight more quickly into the issues around your depression. Avoid self-medication, and people usually self-medicate through substance abuse. Usually this is alcohol, sometimes other drugs. People gravitate towards the substance that alleviates their symptoms most effectively. But the thing is, with all this self-medication, it just worsens the symptoms because the effects are short-lived, and we know that alcohol itself is a depressant, might make you feel better for a very short period, but in the long run, it is a depressant. So you are likely to make your symptoms of depression and anxiety worse, and even due to the fact that you just feel worse about yourself for having become dependent on alcohol or other drugs. So avoid self-medication. If you're already self-medicating, there are ways to get out of it, and getting professional help such as therapy, some form of therapy, is one way to handle that. Discuss all the available options with the professional you are seeing. Decide on what suits you best based on your time and circumstances. Commit to whatever treatment you choose. Go all the way with it. Go the full course. If it's the psychotherapy sessions, go for all of them. If it's antidepressants, go for all of them. See what works best for you. Remember that professional help is only one side of the equation. A lot depends on you and your lifestyle adjustments that you make, that we cover during this 30-day program, the Ultimate Depression Survival Kit. So finally, just to emphasize again that results depend on you. Whatever form of treatment you choose, whatever form of professional help you choose, the results you get depend on you and how committed you are to getting that help, to going through the full course of that help, to talking about what you're experiencing, and to opening up about your situation. That is very important. You are the most important factor in this equation. We move on in the next video to antidepressants with reference to getting professional help.